Hey team, thanks so much for joining us for our very first webinar. I'm so excited about the subject today. We picked this subject because it's something that Dr. Kuba and I talk about all the time on our podcast. And a lot of the problems that we talk about could be easily solved if we just did some good customer service. Now, I do want to tell you that our definition of customer service is quite a bit broader than what you might be thinking about. But team, I want everybody to be thinking about what we're discussing. Every aspect of this applies to every team member. So I want you to take notes and get ready because we've got a lot of good tips for you today. But first,
I think of customer service. I can't remember what, in my mind, when I think of customer service, I think most people think of, oh, hi, how are you today?
Mhm.
How are you, sir? Which is important. And I think when I go into offices or businesses or wherever, I'm the person who actually greets you and acknowledges that you have walked in, right? That's kind of the basics of customer service. I think our goal here, at least my goal, is if that's where we think customer service starts and stops, well, we greeted you, we said goodbye, we knew your name. Yay, good for you. That is not even the tip of the iceberg,
Right.
as far as I'm concerned. So to me, customer service, I think about what stores do I return to?
Mhm.
Where will I spend a little more money? Where will I go out a little further to go shop there,
Mhm.
to go eat there, to go let, the guy check my eyes, whatever it is. Who has made an impact other than saying hello to me? I think for me, my version of customer service is convenience. I think that matters a lot to me. So who has made this process convenient for me? Who has made it accurate for me? Um,
Absolutely. I think it's so much more than just, I think we simplify it too much to be a smile or a wave or my voice was real sweet. And to me, it's just so much more than that. I think it's paying attention to the details, being accessible, being helpful beyond just, like we've got to go deeper to be able to deliver really good customer service.
Can I give an example
Yeah.
of, okay, so I feel like one of the first cruises I ever went on was a Disney cruise, and we got on that cruise ship, and even before, like, you get on, they're taking your picture, you walk in, they confirm who you are, they announce that this family's entering, and then all the characters are there, and they're applauding, and there's somebody there telling you where to go. You could, your luggage is being taken care of.
Wow.
You're going to go eat, you sit down, there was no wait, right? Just wait staff. So we eat lunch, then we get sent to our rooms and whatever, right? The whole procedure of getting on a cruise. Later at night, we go to dinner, and already arriving at dinner, my husband had ordered at lunch, he had ordered a club soda easy ice. There was already a club soda easy ice waiting for him
Wow.
at dinner.
Wow.
We had 3 kids with us. They had 3 kids' cups with straws. Like, everything was already prepped
Wow.
and ready for you. That to me was customer service because that was attention to detail. It was efficiency. Now, could my husband have said, I don't want this club soda? Sure. But to me, it was like you took time. They took time. So it's like, yeah, could we say it's magical? Mickey Mouse was listening, and no, they did some work for that. Like, that wait staff went back and made some notes in their system so that they could make sure that everything was the appearance, at least, of we are trying and we're trying to cater to your specific needs. Compare that to we went on an Alaska cruise. I'll be honest, I don't remember which cruise line it was.
Mhm.
Maybe it wasn't a bad cruise by any stretch, but we walk in and we enter the cruise and there's nobody there. And we were like, what is going on? Because we were already spoiled from,
Yeah.
they're calling you by your name. They're applauding that you entered this cruise ship. Like, we're about to go on this voyage. And like, nobody did that for us on this other,
Like,
whether you're right. So it was just the difference of, was it a good enough cruise?
Yeah.
Yeah. Would I go on it again? Perhaps, but I don't even remember which one it was.
Yeah.
So I think those are things that, how are you setting the stage to be memorable, to be efficient, and to be truly helpful? So you saying hello and running and grabbing somebody a glass of water, well, that's obviously nice, but what are you doing for the entire appointment that really that patient has that memory of going, I'm going to go back there. So even if my insurance changes or we move further away, I don't want to switch that environment because I know I was taken care of there. So
Yes.
without further ado, you want to dive into?
Well, and I want to say one more thing. You're hitting on something that I think is so important, like repeat patients and getting patient retention, making sure patients feel welcomed in this place and stay through anything tumultuous. But also, it prevents complaints. So I was just sitting with a client of mine and we were reading this scathing negative review that came through. And in all honesty, they did one thing wrong. It was one little small aspect that happened after the visit. Didn't even happen during the visit. But on his review, do you know what he comments on? They had a TV in the waiting room that wasn't turned on. And then when I got to my seat, they had it on something that I'm not even interested in. I don't care about painting houses. And so he picked up on little subtle details that then, even though there was nothing inherently wrong in the appointment, when there was a follow-up that occurred that he didn't like, he then uses those lack of customer service details to blast this office. And so it's also providing yourself a little bit of insurance to make sure that you're doing everything in your power to prevent negative reviews, board complaints, even just those upset and angry phone calls that nobody wants to have to deal with. I think if you put the effort in on customer service, you're going to help prevent those things from happening.
We even had a day the other day of surgery cases in our office. I'm looking at the chart review and I'm like, wait a minute, this kid was seen 8 months ago.
Yeah.
So first of all, why are they on my schedule now without having had that? So that's a whole separate issue. But at the end of the day, my point was, what are we doing so that when this kid comes in and if it ends up being more than 3 teeth, which it likely is going to be, at that point, like right after I finished the work, first of all, am I going to get paid? Because this is mom going to be like, I didn't know we were going to need all this work. But that's where it comes in. Like, did I need all this work? Maybe we didn't need all this work. Maybe you just did it because it was, you wanted to bill to my insurance, whatever it is, right? So we want to avoid all of those scenarios. And I think the more detailed you look throughout, that is what builds trust. And it's not easy. It is not easy. Everybody has to be on their A game all the time. I stress that to my team. I'm like, that every patient, every visit, we've got to have those details met.
I agree completely, which is why hopefully full team, you guys are taking notes, even on this first thing that we're going to talk about, which may feel like it's only an administrative thing. And I would say it's primarily administrative, but I want everybody to listen because there's going to be little tips that you can pick up that apply directly to you throughout this patient's appointment. So we are going to go top to bottom with customer service. We want to start with that very first interaction, which is oftentimes a phone call. And then we're going to take it all the way through the dismissal, any kind of follow-ups that happen after that. We are, due to the breadth of this subject matter and how much we want to say about each aspect, we're going to break this into 2 separate webinars. And I think you'll get some really great details or things that you need to improve on. Now, I do want to start at the very, very top, which is going to be phones. And phones to me are where we set the stage for what that patient can expect when they come into our office. And so I want to talk through all the different things that make a phone call either good, great, or terrible. What are your first thoughts when I mention phone calls?
I think it's interesting because, first of all, yes, the phone call matters the most. When I call somewhere and if I can tell they're distracted or if I have to repeat myself 10 times or if they don't even answer the phone, let's start there. There's this phone tree that I've got to go through 8 different options and then I don't remember which option was I supposed to pick 4 or 5. And now like that already, I'm already annoyed. I'm already thinking maybe this is not the office I want to go to. So trying to make it as easy as possible to get the patient to where they can schedule. And I think it's funny though, and I'm not going to say there's a right or wrong per se, maybe you can tell us if it's right or wrong, but I've heard different arguments of, well, we do need to collect their all their insurance information and all their details of what is their concern and reason for coming in today. Because if we don't get that, then now they feel like we've hoodwinked them later if we don't take their insurance, and we spent all this time and now they've wasted their time coming to our office. So some people will argue that. Some will say, no, we need to spend time to get to know them on the phone so that they already feel like we know them when they come in. I'm not a strong proponent of that, but that's, another philosophy. So the point is, have you thought about what you feel like what is important to you in your office? And how are you ensuring that your team is executing that vision? Because again, there's different philosophies and methods of how you think you should enter the phone. I'll let you kind of tell us what you think.
I think you're exactly right. I think we've got to come together as a team and agree on the things that we are required to get in that new patient phone call or any phone call subsequently after that. So things to me that are important, bare minimum things, and then we can build or take away based on these things. We've got to obviously build some type of connection with the patient that does not require a lot of details. To me, connections can be built pretty quickly by one simple tip, which is just use the patient's name. Repeat that name back. So if you're asking at the beginning of your phone call, oh, who do I have the pleasure of speaking with? And the person on the other end says, Joe. Okay, remember that. Remember that you're talking to Joe and incorporate Joe's name a couple different spots throughout the phone call. And it's not magic, but somehow it magically works to make Joe feel a little bit more connected to you in that phone call and doesn't require you asking all of these deep, long questions to get to know Joe. But using the name and
Has a personal touch.
yes, it adds that personal touch, and people love hearing their names, and it's something very positive. So I would encourage you, get that name at the very top of your phone call. Don't wait. A lot of times I'll hear teams that they'll just dive into, okay, what are we seeing you for? What do you need? Blah, 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 blah. And then we don't even know who it is until the end. Oh, and can I get your name and date of birth? And I'm like, oh no, that is so backwards, because now we've missed the opportunity to use Joe's name throughout the phone call. So that to me is a bare minimum that we need to include. But also, this is where I think we miss a lot of details. If Joe is calling in because he's got a toothache, let's say, and so you say, "Oh, who do I have the pleasure of speaking with?" "Oh, my name's Joe Jones." "Joe, it is so nice to meet you. What prompted you to call our practice?" "Well, I'm having this awful toothache," and he goes on and describes this toothache, which they often do when they've got a problem. And let's say that I'm on the other end of the line and I'm distracted. I'm thinking about this lady that's checking in, team members trying to talk to me, and I've missed some of Joe's details that he's shared with me. And then I go, okay, so we need to get you in to get that tooth looked at. Now, is it keeping you up at night, Joe? And Joe's like, I just clearly said that I haven't been able to sleep with this toothache. And so we can sometimes zone out when patients are sharing maybe too much information. We get that. Like, patients will just start to verbal vomit on you, and we have a tendency to just tune out because we're focused on a lot of other things in the practice. But that sets the tone for the fact that we're not going to be paying attention to Joe when he comes in. If we say something as simple as Joe just verbal vomited about his toothache, and then we go, "Oh, Joe, wow. First of all, I'm so sorry that you're having that toothache. That sounds miserable. It sounds like it's keeping you up at night, throbbing even during the day, but especially at night. So I definitely want to get the doctor to take a look at that as quickly as possible." We've just repeated back to Joe what the issues are with some of the specific details that he's used.
I think in our office, being pediatrics, I think for me, one of the most cringeworthy things I can hear when we go back and do call audits. Yes, my kid was on the playground and nurse just called me and she fell and there's a lot of blood. Oh, okay. So did you want to come in today? And I'm just like, are you kidding me? Like, somebody's just calling. They're clearly panicking because their kid fell, like, and just to go, oh, okay. I just think that's awful.
Yeah.
Like, we need to, that to me is poor customer service.
Yeah.
Because now as a parent, I would be like, you don't even care.
Yeah.
You don't care. Am I calling a place that couldn't care less about my kid?
Yeah.
So I think those types of little details and making sure that, yeah, it's hard. So whoever's answering the phone, typically it's hard because there's oftentimes somebody checking in. In our office, we've got headsets. So somebody's calling for an estimate. Somebody else is trying to check out. It's a lot going on, but I think that needs to be at the top of our minds is that's where customer service starts. And you can really tick somebody off if they're, telling you about their pain or their trauma and you're just like, okay.
Yes. And again, that's connection that takes no time. It's just changing the tone of our voice. I think a lot of people feel this need from a customer service standpoint. They're like, oh, I've got to really talk to Joe and spend minutes and minutes and minutes getting to know him. And honestly, it could be something as simple as using his name and an empathetic response like, Joe, I am so sorry that you've been experiencing that pain. That is awful. Just that took what, 2 or 3 seconds to say that, but all of a sudden Joe feels more connected. And so it's being really smart with the connection without having to add a lot of depth to the conversation. And again, we are in a distracted environment. So this is part of customer service. Those people on the cruise ship, they all were in time with the fact that when you stepped on a boat, they're all like, we've prepared for this. Now what if 2 or 3 people were like looking off when you arrived on the ship? You would have noticed that somebody wasn't paying attention. And so, yes, there's distractions. If we can't properly attend to Joe in that phone call, then we need to ask permission. I would not recommend this very often, but if we've literally got all hell breaking loose around us and we know we're not going to be able to pay attention to Joe, then as soon as you get Joe's name, then you could say, Joe, give me just one moment and I'll be right back on the line with you. Or let's say we've gotten to the point where Joe's telling us why he's calling in. Oh, yeah, I've got this toothache. Joe, I really want to hear about this toothache. Give me just one moment. I'm going to get to a private space where I can hear you better. Something like that, that we allow ourselves to clear the clutter and actually be able to focus on this phone call.
Absolutely.
So, name is bare minimum and paying attention to the details. Maybe it's not a toothache. Maybe it's just a cleaning appointment. It feels something basic to us. Still, pay attention to the subtle things that they might be saying. Oh, I'm new to the area. I need to get established with a dental office. Something as simple as, welcome to the area. Where'd you move from? Just something basic like that can connect. Maybe this is an existing patient calling in to talk to you and schedule an appointment. If you've got Weave, you should have access to who that patient is right away. Other call systems I know have that. As quickly as possible, you're pulling up that patient information. So you can say, oh, hey, Joe, how have you been lately? I know it's been a while since we've seen you. I'm so glad you called. I know none of this is easy. All of this is effortful. So I know we make it sound easy and it should sound easy over the phone, but we're scrambling behind the scenes to make sure that we're actually picking up the right patient, talking to Joe like we know him rather than, okay, when was the last time you came to us? Oh, okay, yeah, I've got your file pulled up here. I hate that phrase. I've got your file pulled up right here. How impersonal can we get? We want to make it seem like we're picking up a conversation with Joe and continuing it.
I think it's so easy to get in your rut or routine. Hi, Children's Dental Center of Irving. This is Rena. How can I help you? My toothache, whatever. Okay. When would you like to come in? When were you last seen? Or oh, okay, you're a new patient. Well, yeah, okay, we just moved from Chicago. Okay, well, what do you need? When I'm on the other end, if I've said that and somebody's just like, okay, good for you, right? You feel like, okay, you don't give a flying flip that I've just moved to your area, and there might be an office that does give a flying flip. So, to your point, it's not easy, but it's very intentional. It is very intentionally picking up that phone, ready to listen. And so sometimes it's hard if sweet Sally called in sick and you're the only one there, but that should still be, if your job is to answer that phone, you want to crush it. And what are you doing to arm yourself with being able to say, this is what I need to do my job? The other thing I really hate is the, you call, ring, ring. Hi, can you hold?
Yes.
And I feel like medical, that happens all the time. And it's awful. So if that's you, I guess this is not the scope to go into all of that, but please don't do that. Please don't do that. So we can talk another time about all of that.
Exactly. Don't let that be your default. Even again, if all hell is breaking loose, the phone call is what I call your first impression. Even if it's an existing patient, you're setting the tone for how their appointment's going to go when they come in person. And if it seems like we're so frazzled that we can't even pick up the phone and say hello without placing them on hold, they're starting to build their expectations for how the rest of their visit is going to go, or they're just equally annoyed. Like, you may be annoyed that that phone is ringing and they're immediately like, can you hold? And they're immediately annoyed. So then when you go back to pick up that phone call, you've got an annoyed patient on the other end of the line rather than somebody that was happy to see
job done with Charter.
Yeah, exactly.
Because now you might have to say no 5 times because they want to come in on Sunday at 7 p.m. And you'd have to say no to 7 p.m. and no to 3 p.m. and no to Saturday at 9 a.m. So that can quickly go something.
Now, I know we joked earlier that tone of voice and smile isn't everything in customer service, but it's a really important part of these phone calls. We have to communicate somehow. They can't see us. They can't see our face. They can't see what's going on around them. Only thing they hear is our voice and what we're saying to them. So a lot of a successful phone call really does depend on your tone of voice and how you're reacting to that patient with your voice and with what you say, like we've already talked about. But tone of voice is really important. And this is an age-old principle. I remember when I got phone trained many, many, many years ago, the very first rule was you smile. And I know it feels frustrating. You're like in the middle of chaos happening. The last thing I want to do is smile, but people can absolutely hear that in your voice. And I know I look like a weirdo driving down the road and I'm smiling when I'm on the phone because I just realized that allows a much more upbeat feeling to the phone call. So you need to smile. If nothing else, let that be your number one vocal trick, is to smile. But then I think in those empathetic responses, it needs to sound like we're also being empathetic. Saying something like, oh, I'm so sorry that's happening, doesn't sound genuine at all. So, oh my goodness, I'm so sorry that's happening. That tone makes it sound like you're actually believable. So we've got to sound like we're happy to talk to the patient. We've got to have inflection. If you're a sweet Sally at the front and you've got a really monotone voice, naturally, your inflection is really narrow, then you're going to have to really pump it up over the phone more so than you'd have to do in person. Because in person, your face helps you, hopefully. Hopefully your face helps you. But over the phone, all you've got is your voice. So you really need to add some inflection, some enthusiasm, making sure that the pace of your voice isn't too fast or too slow. If you're too slow, even if you've got good inflection, it can sound like the phone call is really dragging along. If you're too fast, it can sound like you've got not enough time to make this phone call. And so a patient can start to interpret, oh, they're too busy for me, or, ooh, they're a really fast-paced office. And so the patient starts to build these assumptions that you're not going to be attentive to detail or that you don't have time for them. And that is not the tone that we want to set. So you've got to really evaluate. You may need your counterpart at the front to listen to you and go, was I talking too fast in that phone call? If you've got call records, go back and listen to your phone calls. It is such a valuable tip.
Like if you're listening right now and going, I don't know, am I too fast? Am I too slow? Do I have enough inflection? Do I sound happy? Try to listen to your calls. That's the best way to kind of figure out. And it's really eye-opening when you go back and listen and you're going, oh gosh, that was cringeworthy. Or, oh gosh, how would I react if somebody spoke to me that way if I had just called to schedule myself? And is that how I would want to be spoken to? So I think we've always advocated for going back and doing call audits. And I think that's one really great way. If you don't even know how you come across and how you sound, go back and listen to yourself.
Yeah. And one other thing that I'll say on phones before we transition out of phones is remember that you're likely in a space where patients in your lobby can hear you and they can see you, which means our face tells all. So if we're annoyed with the patient on the other end of the line and we're like rolling eyes and looking frustrated, our patients out in the lobby are seeing that. And so just as much as we're trying to put on our best front for the patient over the phone, we are equally benefiting the patients in the lobby. When we hang up that phone, Be very careful about what you say about the patient that you just spoke with, not only for HIPAA purposes, but also if we hang up the phone with a frustrating patient and then we look at our counterpart and we're like, ugh, it's Joe again. He's got another toothache. Imagine that, right? Everybody in our lobby has just heard us complaining about Joe. It is not a comfortable feeling at all. So you need to be very careful about what you say.
I mean, it's just like, you know, when you're on stage, when you leave your break room or you enter any area where a patient could be, you are on stage, you are performing, and you've got to watch all of that for the entire duration of when you are on stage.
Yeah, absolutely. Okay, so that's phone calls. That's our first impression. It is critical in setting the stage, new patient or existing patient, for what they're going to experience when they come into our office. So, my key takeaways on this are going to be go listen to your phone calls or find a way to record phone calls. If you don't have that capacity, please lean on your counterpart to go, hey, will you listen to me on this phone call and give me some tips, at least for what you're hearing on your side of things? Smile, pay attention to your tone of voice, and then also use those empathetic responses, the patient's name, to connect and pay attention to the details. Help your teammates out by documenting those details clearly on the appointment note. Okay, next thing is going to be that initial greeting. So we've talked to the patient over the phone. Now they're coming in for that appointment. Again, this can be new patient or existing patient. Any first thoughts with that greeting when they come in the door?
Of course, a greeting's important.
Yeah.
I think it would be nice if you knew who was coming. Like if you know on your schedule you've got 3 patients coming and there's, you know, Joe Jones, Dan Smith, and Betty Sue, and a woman walks in. I mean, chances are that's Betty Sue.
Yeah.
And so if you've paid attention, that's always nice. Oh, Miss Sue, welcome in today. That makes all the difference. Again, what Bethany was saying about the name, knowing the name. But you know, it's hard to remember everybody's name and um, address the patient that way. And watch me, you know, say the guy walks in and I'm like, hey, Joe. And he's like, I'm not Joe. Like, we've been avoid those situations too, right? So I think just a greeting, eye contact, there should be a greeting, hello. Even if you're on the phone, just, right? Like some connection. If you are the only one at the front, that's what you're having to do. If if you've got a teammate sitting there with you, teammate, please pay attention. Please pay attention and be like, hey, she'll be right with you. Or you swoop in and go and help if you can. But I think that is another, if you botch that, you're setting up the rest of the appointment to be very stressful for the entire team. You as well, because they're going to check out and walk by you when they leave, but also for the back team, that's just made the job a lot harder if we don't set the tone right from the minute they walk in the door.
Absolutely. And again, this is where business team, clinical team, if you're stepping up to help, you guys are teeing it up for whether you're going to have a good appointment in the back or a poor appointment. So again, we kind of look at this being first impressions, and we want to set the stage from the get-go and avoid anything that could be even mildly annoying. And I don't know about you guys, but I absolutely hate walking into a place where I'm not greeted. And then I'm standing at the counter. I'm like, should I stand? Should I sit? Is there some, and remember the old school sign-ins? Should I sign in somewhere? It's just the most awkward feeling. And so I agree with Dr. Kuba. We've got to, at least, even if we're on the phone, the second we see that door open or hear the door open, I love door chimes, which I know if we've got a security system, that's usually possible to have some type of door chime where we're encouraged to like look up when that door goes off. If nothing else, make eye contact with the patient and motion to them that we see them, like, hi, just for a minute. That is so critical. If we're not on the phone, we should absolutely be greeting them immediately. Don't wait. I was working with an office where they had 3 receptionist across the front, and then the doors probably 10 feet away. It's pretty close. And a patient would walk in and they would wait until the patient walked up to the desk to greet them. And it was this awkward walk. I couldn't put my finger on why it was so awkward, but I think the patient is trying to decide there's 3 people. Who do I go to? Where do I walk up to? And they're not bringing their eyes up until somebody walks up to them. So it was like this weird little dance of like, do I just pick somebody or do I wait for them to greet me? Some patients, I would watch them and the door would close behind them and they would wait for somebody to look up and greet them. And it sounds so small. You're like, is that really a big deal? Yes. Yes, it is. Because it creates an immediate awkward feeling like, do they want me here? Do they see me? Should I say something? And that level of discomfort is not what we want our patients to experience within seconds of walking into our door.
Well, for me, I would feel dumb. I would feel dumb walking in and nobody's looking at me. So first of all, I would be like, am I even in the right building? And then I walk in and then I'm kind of looking up, when you do at like, is this the front of the Chipotle line? Like order here or do I pay here? Like where am I going? Who am I going to? So already within like 5 seconds, I'm already doubting what I'm doing. The dental office is not the place. You already have so much doubt, anxiety. Am I in the right place already? At least at Chipotle, you're going to get good food at the end of it if you just figure out what side of the line you want to go on, right? But you're walking in there happy. You're not walking in. Most people are not walking into our offices happy.
No.
And so you've just made the patient feel kind of dumb, where they're most likely going to feel dumb at some point during that appointment. And nobody likes to feel dumb. So that little detail matters. Even the inflection, like we were talking about inflection on the phone, that is so important. So if you don't know who the patient is that's coming in and you're like, there's no way, or I can't pronounce that name, or et cetera, right? That's one for me where if you're like, hey, who are we checking in today? Versus who we're checking in today. Yeah. Right. Like just that little bit of kind of rush and personal really is very off-putting to me. If somebody does that to me when I walk in, I kind of pause and I just glare at them. So I'm like, what are you doing? Why are you acting like I'm a nuisance? Am I a nuisance here? Because I'm about to pay you a lot of money. So it's just rude. So I would say that is super important, that the immediate welcoming eye contact inflection.
Yes, all of those things. And I think that eye contact is critical as well. I walked into an office recently and the way that I entered was kind of off to the side. So the desk is kind of in the middle and I'm entering on the side of the building. And so I walked in and I can clearly see that there's a front desk, but there's this huge computer screen. And so I was like, I couldn't see anybody behind the computer screen. So it was kind of that weird moment where I'm like, okay, I'm just going to walk up to the desk and see if there's somebody there. Sure enough, I walk up to the desk and kind of move to the side of the computer screen. And lo and behold, there's a lady there. And I was like, oh, hi, and so, but that immediate eye contact wasn't there. I'm like, they need to change that setup because she either needs to shift her screen over so that she has direct eye line to that door so that when somebody walks in, she looks up and kind of at least acknowledges with eye contact. But there was nothing, and I didn't even know that somebody was there until I came around and like peeked around and then she was there. So pay attention to sight lines in your area and make sure that whoever is going to be greeting the patients has the ability to see that door and immediately pop those eyes up and establish eye contact. That eye contact alone will direct the patient, invite the patient to come in. I say the word invite. To me, that initial greeting should feel like you're inviting somebody into your home. You just got here to my house, and how awkward would it have been if I would have just opened the garage door, opened all the doors and been like, find a way in.
Yeah.
That's weird. We would never do that. Or if somebody walks up to our front porch to come in and we just pop the door open and hope that they find their way into the kitchen where we are. We wouldn't do that. We would greet the patient at the door, or we would greet our guests at the door. Same thing. We're not going to get up and go open the door for all of our patients, but our eyes say, come on this way. This is the right direction. So eye contact immediately. Don't let there be that weird pause. If we can incorporate the name, I love that. Most softwares, you can add the patient photo. So even if you've got two females arriving at the same time, first of all, pay attention to age. Is one of them 62 and one of them 30? Hopefully you can tell the difference. And when they walk in, you're like, oh, Miss Susan, how are you? It's so good to see you. So process of elimination, which comes if we're prepared.
Yes.
If we're prepared, we can actually make an educated guess, but also those patient photos help us to identify who they are when they walk in. So name, if possible, tone of voice, actually be happy. That eye contact should be followed by a smile, in all honesty. Like eye contact, if it's like this, doesn't feel very welcoming.
Who are we checking in today?
Who are you? Last name, appointment time. No, but eye contact, smile. Who are we checking in today? Or, oh, Miss Susan, it's so good to see you. How's your day been going? And we start the check-in process. Also, one other tip, which we won't get into here, but make sure you're prepared. Do you need a medical history update on this patient? Is that process seamless, smooth? Have we sent that the day before? One of my other least favorite questions is, did you get your paperwork done? Why do we not know that? Why have we not paid attention to whether Miss Susan did her paperwork or did not do her paperwork? Now, if we sent the link and Miss Susan did not do her paperwork, we can say, oh, I was just wondering, did you have any problems with that link? I noticed that the paperwork didn't get done. I just want to make sure that link came through to you. Yeah, I got it. I just didn't have time. Hey, that's no problem. And then we can kind of move on, because we do want to ensure, did she not get the text message? If there's some kind of issue there, we need to be able to check that and correct that cell phone number or whatever we have set up. But we should never be asking the question, did you do your paperwork? That's awkward too.
That's because for me, I have done the paperwork, which tells me, did you not get it? Like, I spent all that time. Why did I do that? And so the accuracy of the paperwork as well. So this is where I'm talking about details for customer service. If I'm coming in as a new patient and you've sent me nothing, and now you're asking me, did you do your paperwork? And now I'm like, I didn't get any paperwork. You should have gotten paperwork. Man, that for me right there, I'm almost about to walk out, because don't accuse me. Don't make me the guilty party. Even if, let's say I didn't get the link and I forgot. Well, now you're still trying to make me feel dumb. Don't do that to your customers, right?
Yeah.
And or yeah, we saw that you didn't do your paperwork, so it's going to take 10 more minutes or 15 more minutes or however long it takes you to do the paperwork. I sure hope we can see all your kids today. Would you stay, right? Like, nobody wants to be berated to an appointment that they're already most likely not looking forward to coming to. So just being mindful of those details. And again, the point is, if you don't even know the details, you don't know if they've done paperwork, you don't know if they received paperwork, you don't know. I think that's what we're talking about, customer service. Because to me, yes, I could walk in the door and you could be like, hey, how are you? And good to see you. Did you do your paperwork? All of that friendliness, to me, I'm like, you are wasting my time. And that to me is not customer service. That would be like me going to McDonald's and having to repeat my order 4 times versus me going to Chick-fil-A and it's like, they're like, here you go, here's your order, right? Like, those are the places that are costing a little bit more, but I'm going to have a better experience because they're prepared. Me coming in and you greeting me nicely, but you've not done anything to make my life easier beyond that initial hello. So that's where the details really need to matter. It is not easy, but it is something that is absolutely doable and needs to be done.
And I think it also shows when we can say something like, oh, I noticed that you didn't get your paperwork. I wanted to make sure that came through. Or, hey, thank you so much for filling out your paperwork. It lets the patient know that we're prepared for them, and then sets the tone for when they go back and they sit down in that clinic seat. They have that first interpretation of, they were prepared. They were ready for me. They greeted me by name. They knew my paperwork was done. All the other things can even go away, but it looks like we've actually prepared for them. When they sit down in that seat, they're now thinking, this assistant has prepared, this doctor has prepared. So I know it's annoying. I get how annoying it is for patients to show up and their paperwork is not done. As a matter of fact, I would say it's probably one of the top 5 complaints that business receptionists have with patients. They're immediately annoyed. And I get it. You've gone to all the work to send out the link. You've reminded them to fill out the paperwork. They've showed up directly on time for their appointment. And now our sweet Sally at the front is like, the hygienist is going to be so mad at me because this patient is not able to be seated on time because the paperwork wasn't done. I get it. It's totally and completely annoying. And I wish patients would do it, but we don't have very much control over that. So if they walk in and have not done their paperwork, if we show annoyance in our voice and in our face, yes, we're able to get a little bit of that out, and we feel better that we were able to kind of ride the patient for that. But now we have done a disservice to our clinical team. So clinical team members, if every time a patient shows up on time and they haven't done their paperwork, and you give Sweet Sally at the front lip about, did you not remind them to do the paperwork? Why didn't you remind them again? What you're creating is a rock and a hard place for Sweet Sally, because what she needs to do is she needs to be able to greet that patient warmly and get them nice and warmed up so that that patient arrives happy in your seat. But she's so worried about you yelling at her for not getting the paperwork that now she's treating the patient poorly. And now that patient's sitting down in your chair and they're annoyed and you've got an upset patient. So please, we're all frustrated when patients don't show up with their paperwork, but please don't put that on Sweet Sally at the front. That is most of the time not her fault.
Well, I'm going to take it even a step further. Why are you annoyed? It's not a one-off. Probably 50% of your patients every day.
Yeah.
We know it's going to happen. It's part of what we do. Yeah, it is just going to happen. Like, it's like when you live in the city. Oh, gosh, there's traffic today. Yeah, I live in downtown Dallas. There's going to be traffic. So if I'm not anticipating that there's going to be traffic and now I'm upset about it, who's the one who's not prepared? That's like my own mental hiccup I've created for myself to raise my own blood pressure. It should be the opposite. Oh my gosh, there's no traffic today. Oh my gosh, you did your paperwork? That's hallelujah, right? Like, set yourself up for success.
Mm-hmm.
Why are you surprised and upset? It's not an odd occurrence. It's a lot of people don't do their paperwork. So that should be like 50-50. They did it or they didn't. And if they didn't, then now we're going to have to spend some time on it. That is not the hill you need to be losing your cookies on, right? Like, pull it together, because it's so important not to make that patient feel dumb, bad, guilted, because that is going to set the tone for everything else.
Absolutely. And I think one other thought on this is, if we are prepared and we know that Joe Jones did not do his paperwork, if we do that on an iPad, we need to have that iPad loaded, ready to go. If Joe walks up and we're like, did you do your paperwork? And Joe's like, no, I didn't do my paperwork. We're like, pulling out the iPad, let me click, let me load it, let me get it ready to go. That's time wasted. So if you know and you can see that Joe hasn't done his paperwork, it's not showing up in the portal or it's not loaded into your system, preload it onto the iPad, have that iPad ready to go around Joe's appointment time, so that when you say, hey, Joe, I noticed that you didn't get the paperwork done. Did that link come through to you? I just want to make sure you're getting that. Joe's like, oh, the link came through, but I didn't get it done. No problem, Joe. I've got it right here for you. And you're immediately handing over that iPad so that he can get going on it pretty quickly. So,
and or like in our office, someone along the way decided that paper was not what we wanted. Honestly, this old dinosaur, I prefer paper. Like, if you want to hand me paper, I'm like, yeah, I'd fill that out all day long.
Yeah.
Now you handed me an iPad. I'm like, okay, where are my readers? I'm like, what is this asking again? And did I push the wrong one, right? So someone in our office decided. And so one day I was watching it or listening to them, and I'm like, why can't you just hand them a clipboard with a paper form? They might be dinosaurs like me, or they may prefer the iPad, but whichever one you have teed up and ready to go. So it's not a big deal. Yes, I see some of the argument being like, but we're not training our patients to go ahead and do it if we make it so easy for them. Like, please, that's not the spot where we want to lose this appointment. Okay.
Absolutely.
So that's where you're like, okay, like what you said. Yeah. Oh, you got the link. Okay. No worries. Here's our next option. If you could go ahead, do you want the iPad or do you want paper? Or if you don't have the option, have something ready is the point. You should have an option. And if that's even printing paperwork again, you shouldn't have to print it like a blank form. That should be ready to go. Okay, there you go.
Absolutely.
End of story. Move on.
Yeah. And then it also keeps that patient from feeling uncomfortable. And even if they do this every time, I am so glad you said that. Maybe on a good day, we've got 50% of our patients that have done the paperwork ahead of time. But ultimately, if Joe didn't fill out his paperwork today, guess what? He's not doing it next time either. So it's like, let's just rest with the fact that there's going to be patients that don't do their paperwork. And as long as we're always prepared for that and we can make it seamless and smooth, then it's going to make the patient not feel bad about doing that. Because sometimes I'll have teams that are like, but how can we get Joe to do his paperwork? I'm like, well, reminders, or the hygienist can say, "Hey, Joe, I know it's so annoying to have to do that paperwork ahead of time, but it's super helpful for me because I'm able to, number one, get started on time, but also I really like to thoroughly look through that medical history. And I do a lot of preparation for your appointment. I love to be prepared for you. And so I like to review that ahead of time. Next time, if you don't mind trying to do it ahead of time, that'd be super helpful for me." That is so much better than Sweet Sally at the front feeling like she's got to scold Joe for not getting his paperwork
What
done.
I would say, like, honestly, for me, if somebody said that to me, I would be like, "Oh, okay." And in my mind, in one ear and out the other. I don't think that would motivate me to do my paperwork early. Anyway, um, but if you are one, if you are Sweet Sally listening to this and you're like, how can I get a patient to? I would ask your friends that are not in a healthcare setting.
Yeah.
My husband's that way, and I'll ask him, and he just looks at me like, "You're a fool for making such a big deal about this. Like, I'll either do it or I won't. And if I won't, like, what's plan B? Like, let's move on." And so I think that's for the I think most people either don't want to do it, so you scolding them is not going to make them go, "Oh, next time Sally's going to yell at me,"
Mhm.
or "Next time my appointment's going to start late." Most people are already going, "Oh, we start late anyway,"
Mhm.
and they're expecting you to start late in a doctor's office. So that's another customer service tip coming up,
Yeah.
that if you can keep them on time, most people aren't expecting that. And so now you're trying to keep it on time. But if you're like, "Oh, well, we can't start your appointment yet because you didn't do the paperwork." Why? Why bring that up? They know that. They'll figure it out. Yeah. They'll figure out when other families who come in after them, their paperwork's done and they get called back before. They'll put the pieces together.
Exactly.
Or they won't. Again, it's not the hill you want to die on.
No.
Paperwork.
It's one of those annoyances we just have to deal with, honestly, on a daily basis. And the way that we react to it has to come from a customer service standpoint. We can't be worried about what's most convenient for us or what we prefer. Customer service is we turn our attention to what's best for the customer or for the patient in this case. And that means being prepared, having backup paperwork ready to go, making it as smooth and seamless as possible, and not making that patient feel bad about it. Now, in addition to the initial greeting, I want to take a minute here to talk about our general reception space. Call it lobby, call it waiting room, whatever you call your space. I think first impressions are everything when it comes to how happy a patient is going to be with us and how well cared for they feel. So I think we've got to actually think about our space. You and your team do a great job of this. I would encourage everybody on the team to take an opportunity to set up a system where we do a office walkthrough, starting in your parking lot. When that patient pulls in, what are they seeing? Do we have dead plants by the front door? Do we have our area covered with leaves that have fallen? Is our parking lot always littered with trash? Because it's just the environment that we're in, our demographics. You need to think about have somebody on your team, and y'all do an office walkthrough. Is it monthly?
Monthly. Yes.
And so it needs to rotate through the team because everybody's going to see things differently. But we've got to make sure that when the patient pulls in, that we've got looking nice as we possibly can. When they get to that front door, is if it's a window, is it covered with handprints? Is it dirty? Is the actual door handle dirty? Do we have a nice mat that's good for people to stomp off dirt? We want it to look like we've prepared for them, like we're ready for them. And the same thing when they come into that reception space. Have we really thought about what it feels like to walk in those front doors? Have we sat in the seats in our waiting room or in our lobby? Do we have some that are firmer for people that might have trouble getting up off of really soft seats? Do we have ones that are for heavier set people? Have we checked our weight restrictions on our chairs? And do we have chairs that are meant for different body shapes, different sizes? Is it too cold or too hot in your waiting room? What about the cleanliness of your space? Do we constantly have little crickets in the corner that we haven't really picked up? Do we have cobwebs? The list could go on and on. Can you?
I think that was probably one of the moments that I was like, I have never thought about that. But a woman walked in and she said, "I can't sit anywhere." And I think my receptionist was like, "Excuse me?" And she's like, "These chairs are not going to hold me." And I was like, how awful for this woman
Yeah.
to like feel that way when she walks in. And my thought was never again. And that's what, I mean, like the thought of having to know the weight capacity of a chair had never crossed my mind.
Mhm.
Um, and we've got a colleague, I know you help in her office as well. She has got really squishy couches. Well, a lot of her clientele is older, and it's not occurred to her, and I don't want to say it to her, and I haven't, but to me, I'm like, I know people who've walked in there and who've gone, I don't want to sit because I'm not gonna be able to get back up.
Mhm.
So thinking about those little details, I think another one that really is one of my pet peeves as a consumer walking into an office and I see that all the magazines are old.
Mhm.
I know there's a period after COVID where we all got rid of magazines. We've brought them back. Like people, want something to read oftentimes. A lot of times people don't have it because they're like people are on their phones.
Yeah.
But if I walk in, yeah, I'm going to count on my phone unless I see something interesting sitting there. If it's something interesting, you're going to keep me there and less likely to be like, now I have something interesting to look at. Sometimes I'm like, take longer because I want to finish this article, right? Like I didn't get to this part. But it's really annoying if I'm walking into the office, say in June of 2024, and the magazines are from like November of 23. That to me, you're not paying attention to detail. So when was the last time this counter was even wiped? Like but that's where my brain goes. So I think those details matter. What does it sound like? Do you walk in and it sounds like a clinic because you can hear a pin drop? I don't like that. That makes me very uncomfortable. Is it too loud? Do you have a TV on and it's really loud? And do you have clients that come in that have hearing aids and now they're going to be miserable in there because they can't,
Mhm.
those little things, you got to know your clientele and kind of cater to that down to that level. What does your office smell like?
Mhm.
When you walk in, I think somebody once made a comment about the smell of dirty diapers or something. And my staff was very sensitive to that. They're like, well, we see kids. What do you imagine? I'm like, but it's a good point. I don't walk into the pediatricians and it smells like dirty diapers.
Right.
So
Yeah.
is it, do we not have little baggies for diapers? Like our parents just throwing their diapers anywhere? It's detail, but you want to walk into a place. If you walk in and it smells sweaty or stale or like dental products or not acceptable,
Yeah.
you walk right out.
Exactly. And even just sometimes when we live in our home, in our office, I equate the office as it's our home. And so if we've invited people in, patients in, we can get used to little things that we just become okay with. Like, oh, I was in the office the other day where they had recently moved the computer off the wall and had put it in a different spot. And so the wall was still patchy where that computer was. And so I was standing out in the hallway observing, and I was like, that patch just does not look good. And so somebody then walks into that operatory, sits down, and they're like, do they not take care of their place? Like, there's a patchy wall here. Like, it doesn't look good. And again, now that goes to, are they using quality materials? Is this place even up to date? Are they clean? Are they paying attention to infection control? We know we are. Let's hope you are. But we know we are doing that. But patient perception is everything. And then what if they've got a feeling that just stays sensitive after they've had it done? And now that little patch in the wall comes into their mind like, oh, maybe I didn't go to the best place. I'm not so sure. Maybe this is a bad feeling. And now they've interpreted it as we haven't done quality work because of something so simple that if we would have just taken the time to repair it, make it look good, or to make sure that it's welcoming and warm and smells good and all of that, it all goes to the patient satisfaction. And I think those things are critical.
If it's not your strong point, like for me, there's a lot of things I don't notice. No clue. But then I've got my bougie Betty. Like who's the one who walks in and like really pinpoints and like, oh, your car is a little dirty. Oh, you put your bag on the floor. Why would you do that? Your bag needs to be pristine. Oh, and you're like, oh gosh. Have bougie Betty be the one that walks around, right? Because she's going to notice those things. So if that's not your strength, and if you're going, you know what, if you're going to complain about a patch in the wall, that don't get out of here. Don't even be my patient. If that's your mentality, then you don't be the person. Like,
Right.
don't lose a patient over something like that. So if you're like, a chill cucumber who's like, yeah, it's all good, you're not the person to take that role. Find somebody who is your bougie, nitpicky person, because you will have patients that are like that.
Absolutely. So I would say, to me, these are kind of the first components of customer service. We've talked about phones. We've talked about that initial greeting. We've talked about our space and making sure that it looks welcoming and hospitable. And then also we need to be welcoming and hospitable. If there's a restroom in our lobby, then we need to say, hey, by the way, if you need our restroom, it's right there. Or if we've got water that we offer the patients, hey, you've got just a few minutes. Thank you so much for being early for your appointment. Can I get you some water? I'd love for you to have a bottle of water on us. Make it feel hospitable, just like we would do to our guests when they come into our home. We want our patients to feel the same way. We want our reception area to look receptive, but we also want to be receptive and be very hospitable. So I think these are all the things that set the stage for really high customer service, high detail, high preparation. All of this has to be intentional. And then we are going to transition in our next webinar to part 2, which is going to be behind the reception doors. Everything clinically that we can do to make sure that we maintain that high level of customer service that we've hopefully set in these initial stages.
I think on our hub, we have kind of a checklist that talks about, if you're like, yes, I want to get ready and get to it, but I don't know where to start. We have a checklist on our hub that you can go and print out and then, customize it to what you need. If you have a coffee bar in your entrance and there's 2 pods in there, or there's 1 cup, or the trash is overflowing. I think that for me, especially if I'm a morning patient and I walk in and it's, 8 in the morning, the trash is overflowing already, that just makes me feel, pay attention to this. What is going on here? It just, to me, conveys, I don't know, chaos almost. Like, why is this overflowing right now? This is kind of gross. So if you don't have a coffee bar, then skip that part of the checklist. But there's items on there that will help get you started to make sure that you've got a space that you have thought about all of these little details.
Absolutely. Hey, thanks for joining us today. I really hope that y'all been taking some good notes as we go through this content and do something with it. Don't just listen to it and go, oh man, those are really great ideas. Actually put some action items together to make sure that you make improvements in these areas, either all 3 of the areas that we've talked about today, or if you're just like, oh, we've really got to focus on this reception area, make that top of your list and start there and then improve some things. It is going to be fantastic for patient satisfaction, but also you're protecting your practice. I can't emphasize this enough. If we can get patients off to the right start, we have happier patients in the chair, we have happier patients leaving the office, and it just minimizes the risk of somebody being unhappy, writing a negative review, reporting us to the board. It just is a starting point. So take this seriously and take some good action steps today.
Patients are more forgiving if they feel like most of everything went right, felt right. So if I already don't feel right because I've walked in and I tripped on the mat in the front because it had a tear in it, and now I've stumbled in the building, nobody greeted me, I didn't know where to go. I walk up, who are you? How do you spell your name? I have to repeat my name 3 times, even though I was just there last week with my other kid, right? Like, already I don't feel good. And so now my guard is up. Now something happens that makes me go, wait a minute. That is a very slippery liability slope to slide down. And the details matter. This is where it all starts. So if you have done your job to help tee this up as best as you can, so that if something does go wrong, oh gosh, we were supposed to scale your upper left quadrant today, but we numbed you on the right side instead. If all of these other things had gone wrong, my thought would have been like, y'all don't know what you're doing in this establishment. I don't know what's going on here. As the opposite being, if I walked in and all of those things were right, and now the wrong side has been started, I'm going to be far more forgiving because I already had a good feeling up until that point. And at that point, it's mistakes can happen. Luckily, we caught it before we moved on further. So it really is that important.
It is. Yeah. So get after it. Good luck, and we'll see you next time.